Welcome to DermTV Viewer Questions Week for April 2014. Today's episode will feature questions from DermTV YouTube viewers as well as DermTV.com viewers. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. The first few questions are coming from DermTV YouTube viewers. And YouTuber KO Puppy asks about the easiest way to identify a precancerous mole. I have a little mole that's completely symmetrical, but it hurts. Should I be worried? KO Puppy, you shouldn't be worried if it hurts if it's just been a few days or even a week. But if after 2 weeks or at the most 3 weeks it hasn't come back to normal, then it's time to get it examined. If the mole is raised, it's very common for raised moles, which are called intradermal moles, to get pimples inside of them, and that's usually what causes them to be painful. If it's a flat mole, those usually don't become painful unless they've been scratched or hurt. But a painful mole is usually not a sign of a bad mole, but like anything else, if it doesn't go back to normal in 3 weeks, it's time to get it checked out. The Beauty Box Boutique asks about broken capillaries. I have talengectasias on my face. I'm African American. What do you recommend, as I've heard that lasers will not work on African American skin? Beauty Box, I have good news for you. That's just not true. Some lasers may not be appropriate for African American skin, but certainly the lasers that remove broken capillaries work very well on African American skin or any skin color, because these lasers are specific for the color of blood which is in the blood vessel, independent of the color of your skin. Monica Herrera asks about how to get the best exfoliation. I'm 38 with acne, and right now I'm on retin A micro 0.04. However, I've noticed that my hyperpigmentation has gotten worse. Please advise, is it true that with time the retin A will take away the hyperpigmentation? Monica, first of all, with any skincare regimen, you should never get worse before you get better. Number two, what you're describing may well be a result of mild irritation from the retin A, and irritation with retinoids, as you probably know if you're a fan of Durham TV, is not an uncommon situation. When you're using retinoids for hyperpigmentation and you don't get irritated, they very often will be effective at helping to reduce hyperpigmentation. But in this case, where it's getting worse, I think it's time to discontinue that product. It's not for you. Lily341 asks about Derm TV Viewer Questions from March 2014. I know that I'm supposed to apply sunscreen first to my skin. I now am going to be using antioxidants at night and not during the day. Great. But I have UVA, UVB sun protection moisturizer for my face and also a broad spectrum protection eye cream that I use during the day. My question was, since these products in a sense overlap each other on my skin near my eyes, will that in some way make the products less effective as a sunscreen in those areas? And really, Lily, not at all. My recommendation is apply the product, whether it's the facial product or the eye product that has the higher SPF, apply that one first, because whichever one goes on your skin first is the one where you get the results truer and closest to that SPF, and use the other product second. And if they do slightly overlap in the eye area where they border, it's not going to be a problem, and they're not going to invalidate each other. Really good questions. Let's go to the DermTV.com viewer questions. First question is from Cam, and Cam says, I over-scrubbed an area of my skin with a microdermabrasion scrub. How can I get it to heal without scarring and quickly? When you've over-scrubbed with microdermabrasion scrubs, usually what you've done is you've taken away the top layer of skin. That's sort of like a first-degree burn. And the way we treat burns is usually with ointments. Antibiotic ointments like bacitracin or polysporin are perfectly appropriate to use because the ointment helps the new baby cells migrate in faster from the edges of the wound or come up faster from the bottom of the wound to restore the damaged skin, and the antibiotic in the ointment just helps to protect against an infection. And this is one of the reasons why I caution people about physical exfoliation in terms of not necessarily being able to get predictable end results, because those results depend on how long you do it, how hard you press, and what the exfoliating medium is, and it's easy to overdo it. So remember, less is more. Tish asks, can you get second-degree burns from laying out on an overcast day? Really interesting question. The reality is, yes, you can get a second-degree burn, which means a blistering burn from the sun, even though you can't see it because there's cloud cover. Depends how much cloud cover there is, depends on the time of the day, depends on where you are with respect to the equator and the season and so on and so forth, because it is the UVB that causes first, and second-degree burns from the sun. But bottom line is, you need sunscreen every day, 365 days a year, whether it's cloudy or not, because you can get a second-degree burn through the clouds on a cloudy day. And today's last question comes from Graciana, who asks, can you use glycolic for exfoliation every day for the rest of your life like a moisturizer and sunscreen? When do you need to stop using it? Graciana, I think glycolic exfoliation is part of your daily routine, just like taking care of your teeth, taking care of your gums, and this is taking care of your outer skin. And just the way you're going to brush your teeth for the rest of your life, I believe that glycolic exfoliation should be part of your daily routine for the rest of your life if you want younger looking skin, if you want to prevent and help treat acne breakouts, which obviously won't go on for the rest of your life, and if you want to help remove the early abnormal cells that sometimes can stick around and help lead to precancerous growths. So just the way you're not going to stop using cleanser, moisturizer, or sunscreen, I hope you won't stop using your glycolic exfoliants. So that's it for this month's Viewer Questions Week. And don't forget, the subjects from so many DermTV episodes come from your questions, which are great. So please keep sending them in, and I'll keep answering as many of them as I can. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.